We know these are difficult times for businesses as we continue to do our part to mitigate the impacts of this devastating and unprecedented pandemic. Our hearts go out to everyone suffering economic losses related to COVID-19 right now, but most especially to those who have lost loved ones in this deadly virus. With the current surge in cases, now more than ever, it's critical that we follow the protocols of the health officer order. The most recent orders can be found on our website at publichealth.lacounty.gov, along with a lot of other useful resources and information for businesses and individuals. As many of you know, the Southern California region, including LA County, is currently under the state's Safe at Home order. As a reminder, the following sectors are closed under this order: card rooms, wineries and breweries and distilleries, museums, botanical gardens, zoos and aquariums, personal care, including hair salons, barbershops, and nail salons, and family entertainment centers. And the following activities are permitted with safety modifications, including required wearing of face coverings and required distancing of at least 6 feet. Standalone grocery stores are now able to operate at 35% occupancy. Retail stores and shopping centers are able to open at 20% maximum occupancy. Restaurants for takeout and delivery only, and this will go through at least December 27th under the state's order. Parks and trails are open, outdoor gyms are open, as are playgrounds and childcare. These all remain open. Again, everyone is adhering to masking and distancing requirements. All government and critical infrastructure sectors are open, as well as all healthcare facilities and services operating under strict infection control requirements. These facilities are open and able to care for you and your customers, so please seek out assistance and medical care when you need it. With that as background, public health continues to encourage businesses in all sectors to participate in our not so new, but sort of new COVID safety compliance program, which is also known as the CSCCP. This online training course, available in over 13 threshold languages, is designed to ensure that both employers and employees know the essentials of the county health officer orders and what they mean to the businesses and how they need to and how they can be in alignment with those protocols. To earn a certificate, participants simply need to watch a 37-minute video that outlines the required protocols for all sectors and then complete a brief survey at the end of the training. The training course offers an in-depth overview of the 5 key areas of all sector protocols and then directs participants to sector-specific guidance. Workplace policies and practices to protect the health of employees and customers, measures to ensure physical distancing at the worksite, measures to ensure infection control within the worksite, communication with both employees and the public, and measures to ensure equitable access to critical services. The training, while not mandatory, offers businesses, employees, and customers alike the added reassurance that essential training has been completed in order to prevent the spread of COVID-19. The CSCCP program is voluntary. Businesses that opt out of participating will be required to instead display the DPH COVID-19 protocols for their sectors, which can be multiple pages long and can take up quite a bit of real estate on your storefront. The certificate is 1 page, very attractive, well designed, and gives quick assurance, sort of like a restaurant grade, that your business is in compliance and understands the protocols to keep customers and employees safe. To date, 14,673 businesses have completed the training. We encourage all businesses, regardless of sector, to take advantage of this training. And it's important that each of us take this action to keep our customers and employees safer. In closing, the safest thing we can do during this very difficult time in the pandemic is to stay home as much as possible and to interact only with members of our own households. However, for most families and businesses, it's not possible for all the members to stay only within their household bubble at this time. Many of us, and again, thank you to all of the essential workers, still must go to work. Some of our children are at school, and we all need to access essential services from time to time. Some of you are essential services. Every time we leave our homes, however, and are around other people, we are exposed to COVID-19. The more frequent and varied places we travel, the more exposures we have. And when each person in our household returns home, they each bring with them the risk associated with their encounters. When there are tens of thousands of infected people out and about each day, there is a significant increase in the probability that among the many encounters each individual has during the day, that one or more of these will now be a person infected with the virus. Minimizing the number of encounters is the first strategy for lowering your risk, and this means you should leave your house only for the most essential activities. When we do leave our homes, there are also steps that we can take to minimize the risk. Again, wear face coverings at all times, and we need to keep a distance of at least 6 feet from others, and wash our hands frequently, and stay home if we're sick. So when we're at the store, a park, or going to work, these remain the essential strategies. We have to combat this virus and to keep one another safe. This is the most dangerous time for Los Angeles County, and we are asking everyone to please be extremely careful and diligent in protecting yourself and everyone else. There's a great deal of community transmission, and we are all at risk of becoming infected when we are out of our homes and around other people. So please use every tool at your disposal so we can all be as safe as possible. And again, we encourage you to check our website, publichealth.lacounty.gov, for the most recent updates to the training program and our protocols. And with that, thank you and look forward to your questions.